Time is running out for many Nebraskans to choose their health insurance.
Yeah, and the same is true for Congress to pass a health care deal before millions of premiums soar in 2026.
KETV Investigates Beth Carlson spoke to an Omaha woman battling between sky-high health insurance costs or no insurance at all.
I know I'm not the only one that's going through this.
Diane Braun is one of over 100,000 Nebraskans faced with a hard choice.
I don't know what the heck I'm going to do.
She contacted me after KETV Investigates reported on Affordable Care Act marketplace premium increases last month.
I get a letter in the mail that says, hey, we're going to keep your insurance. There's just a few little changes. Your deductible's going up a little bit. Your complete out-of-pocket's going up a little bit. And your premium's going up a little bit. And it increased by 460%.
From $560 a month for her and her husband's premium to $2,583 a month.
The premiums alone would be about 31% of our taxable income.
For years, her and her husband have used the ACA marketplace to find coverage, as they both are self-employed.
I called my health care plan and I said, I noticed that the premium went up. Can you tell me why? And they told me part of it was, with regards to no longer having that tax care advantage, and that they're allowed to increase their insurance premiums.
But this year, they will no longer qualify for subsidies, even though their income hasn't changed. And it's left Braun with a few options.
We either, one, pay the extensive premium, which would be about $31,000 a year for the premium alone. Two, one of us closes our business and goes to work for someone. Or three, we just don't have health insurance. And we cross our fingers that we stay healthy even though we keep getting older.
She's not alone. KETV Investigates found that 91% of ACA marketplace users in Nebraska will have a higher premium in 2026.
I don't think it's about political. I think it's about human care, about taking care of everybody.
One expert says it's caused by enhanced premium tax credits set to expire at the end of 2025, unless Congress chooses to extend the credits. She says as prices jump up, the number of Nebraskans considering dropping their health care insurance is spiking too.
The increase is on people choosing not to enroll.
Teresa Chavez is the financial enrollment supervisor at One World Community Health. They offer free services to help families enroll in the marketplace.
The report that I ran 90 applicants, and 40 enrolled in higher plans, of course, and then 36 decided they could not enroll, and then some of the others, the application was not completed or they were sent to Medicaid.
That's over a third of clients choosing to go without insurance.
I think they didn't know what they heard in the news, how it would impact them as an individual.
They say that this year specifically, the need is unprecedented, and not just for those below the poverty line.
Even like the middle class folks is where the premium subsidies are. What I used to think was a lot of money is not a lot of money today.
Their goal? Let people know their options before it's too late. Enrollment for coverage starting at the beginning of 2026 ends on December 15th.
There's several plan options. So we kind of go through them and see if there's a better option than the one they had.
We met with Braun again a week later to discuss what coverage she was able to find. A provider helped her find a cheaper plan in a different network.
Instead of being 4 figures, it was 3 figures. It was definitely more than what I was paying this year, but it was a lot more reasonable.
Saving her $1,800 a month on her premium alone.
They wanted to charge us up to $25.83 a month, and now we're down into $700 a month.
She's paying more now.
It's a huge weight lifted.
But it's better than paying the price of no insurance down the road.
Knowing that I'm going to be okay if I get sick, even with the higher deductible, that we can cover.
Beth Carlson, KETV Newswatch 7.